Hi, this is Dr. Reynaldo Ong-Joson, Director of the ROJoson PEP Talk. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in Medical Management of Skin and Soft Tissue Tumors, Part 2. This is part of the health disorder course. Part 1 consists of the following contents. What is a tumor, a soft tissue tumor? What are the different types of skin and soft tissue tumors? What are the causes of skin and soft tissue tumors? And how common are the skin and soft tissue tumors? In part 2, the following will be the contents: clinical diagnosis of skin and soft tissue tumors, paraclinical diagnostic procedures for skin and soft tissue tumors, treatment and prognosis for skin and soft tissue tumors. Some definition of terms in the title and delimitation of the coverage of my talk. Fundamentals, to mean simplest and essential facts and theories which can serve as a basis or foundation and support for advanced information. Generalities, general statements of information, not covering specifics and details. Medical management, to mean diagnosis and treatment by physicians. The clinical diagnosis of skin and soft tissue tumors as the first topic. Clinical diagnosis means a conclusion or decision made by a physician after examining a patient and after evaluation of the data and on symptoms and signs. Symptoms are what are felt and observed by the patient or a person on his body or her body. Signs are findings of a physician after physical examination of a patient. The procedures in the clinical diagnosis of skin and soft tissue tumors. It starts off with the patient having symptoms. The physician evaluates the symptoms to look for cues for a skin and soft tissue tumor, and then cues or patterns for a particular skin and soft tissue tumor. Then the physician does physical examination to look for sign cues of skin and soft tissue tumor, and then cues or pattern for a particular skin and soft tissue tumor. Lastly, the physician processes the symptoms and signs to determine 1, whether a skin and soft tissue tumor is present, and 2, if present, what is the type or the specific clinical diagnosis. The processes used in the clinical diagnosis of skin and soft tissue tumor consist of the following: pattern recognition and prevalence. Pattern recognition process means realization that the patient's presentation conforms to a previously learned picture or pattern of disease. Prevalence process means the choice of a diagnosis is based on the frequency of occurrence of the disease in a certain locality, in a certain age and sex group, and in the affected organ and system. The common symptoms that will lead to suspected skin and soft tissue tumor will be the presence of a tumor or a mass or a buccal, felt and or seen on or over the skin. So the questions are: is there a skin tumor? Is there a soft tissue tumor? If there is, what type? Based on the location of the tumor, a skin tumor is one that is in and on the skin, whereas a soft tissue tumor is one that is in and on the soft tissue. So a skin and soft tissue tumor is an unusual and abnormal collection of tissues occupying the skin and soft tissue, and it is not a prominence like this, indurations, swelling, skin rashes, or discoloration, or enlargement. An infection of the skin and soft tissue may present as a tumor. Usually the tumor is an abscess, one that contains pus. And based on the cells and or tissues of origin, skin tumor can arise from basal cells, squamous cell, melanocytes, skin glands, blood vessels, nerves, and connective tissues, whereas soft tissue tumors can arise from fatty tissues, muscular tissues, connective tissues, blood vessels, and nerves. Examples of skin tumors: basal cell carcinoma arising from the basal cell, squamous cell carcinoma arising from the squamous cells, melanocytes can give rise to mole or nevus, and melanoma. And then other examples will be seborrheic keratosis and seborrheic adenoma, hemangioma, lymphangioma coming from the blood vessels as well as the lymphatic vessels, neurolymphoma from the nerve, fibroma from the connective tissues. And also the others will be epidermal cysts and warts. Fat tumor can give rise to lipoma or liposarcoma, the cancer equivalent. Muscular tumor, example would be rhabdomyoma or rhabdomyosarcoma, the malignant counterpart. Connective tissue tumors, example would be fibroma and fibrosarcoma. Blood vessel tumor, hemangioma or hemangiosarcoma. Nerve tumor, neurolymphoma or neurosarcoma. So how to diagnose skin tumors? Skin tumors. Okay. Look at and feel the skin tumors and check whether it is confined to the surface of the skin or it beneath the skin at the epidermis and dermis level, and look at the appearance of the skin tumors. The tips here will be on how to diagnose skin tumors is to learn and know the pattern of the skin, of the common skin tumors, and then learn and know the cues for skin abscess, and learn and know the cues for skin cancers. Example, if you see a dark brown to black tumor on the surface of the skin, which is the appearance, okay, with no change, history with no change in the appearance since its first detection, the primary clinical diagnosis is a mole or nevus. If you see a superficial skin tumor, firm, raised, wrapped surface, may appear cauliflower-like, then the diagnosis is a wart. Tumor immediately beneath the skin with an eye or a punctum, then the diagnosis is epidermal cyst. A tumor immediately beneath the skin with redness, tenderness, fluctuant, with pus, the clinical diagnosis is an abscess. So these are the cues for skin abscess. Okay. Now, cues for skin cancer, usually tumor on the skin surface, history of non-healing of a sore, okay, with raised border. So these are the cues for skin cancer. A tumor which looks like a mole but increasing in size and appearance over time, then one has to suspect melanoma. Now, how to diagnose soft tissue tumors? Look at and feel the soft tissue tumor. Determine the nature of the tumor, whether it's solid or cystic, border, whether it's clear or not, consistency, whether hard or not, mobility, whether movable or not, tenderness, whether it's present or not, whether it's tender or not, then appearance on the skin surface. So tips here will be to learn and know the pattern of the more common soft tissue tumors. Then also know the tips, the cues for soft tissue abscess and also soft tissue cancers. For soft tissue cancers, the cues are usually these tumors are deep in the muscular layer and they are hard and fixed. For lipoma, the most common benign soft tissue tumor, the pattern for recognition is it's on the subcutaneous level, solid, clear border, soft, movable, non-tender, and no skin changes. For a hemangioma, this is a hemangioma. Okay, the pattern here is that it's subcutaneous and sometimes up to the skin level, soft with skin discoloration, bluish to suggest blood vessel tumor. So we think of hemangioma here. Paraclinical diagnostic procedures for skin and soft tissue tumors. The foremost indication for a paraclinical diagnostic procedure can be stated this way. If you are not certain of the primary clinical diagnosis and you need to be certain or be more certain before treatment, then go for a paraclinical diagnostic procedure. To decide on the indication of the paraclinical diagnostic procedure, the physician uses two processes: degree of certainty on the primary clinical diagnosis and comparison of the treatment plans for the primary and secondary clinical diagnosis. If there is a need for a paraclinical diagnostic procedure, the physician uses the BRCA processes. B stands for benefit, R risk, C cost, A availability. The physician gives or lists the various options of the paraclinical diagnostic procedures and then gives data on BRCA. With the data given, the patient is asked what he or she prefers. Example of a BRCA comparative analysis of paraclinical diagnostic procedures, option 1, 2, 3, and then the accuracy is 99% for option 1, 90% option 2, 60% option 3. Assuming that all the risks are acceptable, cost for 4,000 option 1, 3,000 pesos for option 2, and 1,000 for option 3. Assuming that all are available, what is the best option here? The best option here will be the one with the highest accuracy rate, which is 99%. Common instrumental and laboratory diagnostic procedures that can be used after clinical diagnosis of skin and soft tissue tumors. Essentially, it is biopsy, which is a procedure done to obtain and examine under the microscope samples of body cells and tissues. So these are the various types of biopsy. Close biopsy, meaning without cutting the skin. So there are usually two types: fine using a needle, fine needle, or the core needle, a bigger gauge needle. Open biopsy, there's a preliminary cutting of the skin. It could be a section, just part of it, or excision, the entire tumor. Punch biopsy, just punch the tumor, okay, using a punching instrument. Pinch biopsy, just pinching a piece of the tissue from the skin tumor that is fungating like a cauliflower. You just pinch one part of this one and then have it examined under the microscope. Competencies required of physicians managing skin and soft tissue tumors. Know the uses and indications of all known instrument and laboratory diagnostic procedures for skin and soft tissue tumors. Use as needed and indicated. Select the most cost-effective one. Know how to interpret the results. Biopsy. For soft tissue tumors with intact skin, so one can use the closed biopsy, which is a needle, which could be fine, or a core needle, which has a larger bore or gauge. Okay. Closed biopsy means there is no prior cutting of the skin. The other type of biopsy that is usually done for soft tissue tumors with intact skin is an open biopsy. There is a skin cut or cutting. It could be either a section or removal of the entire mass or tumor, which is called excision. So this is an example of a BRCA on the type different procedures for soft tissue tumors: fine needle, core needle, open. Open meaning excision or section. Okay. Benefit, comparative benefit: 90% yield for fine needle, 95% yield for core needle, 99% yield for open. When you say yield, the diagnostic yield. So risk, least invasive for the fine needle. Most invasive, there's a scar that will come after the procedure. So for open, and then the highest cost will be is the open biopsy. So assuming that all are available, then the patient is asked what he or she prefers, and the surgeon will, the physician will also make a recommendation. Treatment of skin and soft tissue tumors, usually operation is the main modality of treatment. When you say excision, it's usually done with the minimal margin from the tumor. It is usually done for non-cancer tumors. Wide excision, there is a good margin from the edge of the tumor. This is usually done for cancer tumors. Other treatment modalities such as radiation or chemotherapy may be added for cancer tumors. Prognosis, usually good if diagnosed and treated early. For non-cancer tumors, majority as high as 99% will be cured. For cancer tumors, majority will be cured if diagnosed and treated early. Okay. Cancers with poor prognosis are usually these sarcomas, the soft tissue sarcomas, and melanomas. So summary and takeaway in this part 2. I have discussed the clinical diagnosis, paraclinical diagnostic procedures, treatment and prognosis for skin and soft tissue tumors. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on fundamentals and generalities in medical management of skin and soft tissue tumors. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of skin and soft tissue tumors. With that, I end my talk, Fundamentals and Generalities in Medical Management of Skin and Soft Tissue Tumors, Part 2. I hope I have empowered you, the lay people, to have a better understanding on the fundamentals and generalities in the medical management of skin and soft tissue tumors. On that note, I'd like to say good day, thank you, and mabuhay kayong lahat.